Hi Tina, how you doing today?
I'm doing great today.
Great. A couple weeks ago, we put an Inspan in you. You were having some pain down your right leg, and that had been going on for how long? When did it get worse?
It probably was going on for about a year, and it got worse in January of this year.
And it got really worse.
Really
and you were really miserable when you came to see me.
Yeah,
I mean, level 8 to 10 pain.
definitely.
I mean, you were really suffering. And I knew when I looked at your MRI, I knew there was pressure on the nerve.
Right.
Now you had 2 prior surgeries, and you had actually seen a surgeon who maybe suggested a fusion in the future,
Right.
which is usually have 1 surgery or 2 surgeries, and then they're looking at fusion. But we were able to, once I figured out which exact area was the problem, I was able to go in and really fix that problem. Instead of fusing, doing many levels, I was able to find the one level where it was affected and go in and put a spacer in. So what it does, what I did is, she had some pressure on the exiting nerve roots here. So what I did is I put the Inspan actually will dilate here, and then it fixates it open. So it takes pressure off the exiting nerves and it creates space in the spinal canal. So we did the surgery about a couple weeks ago, and you noticed improvement pretty immediately?
Immediately, yes.
Mhm.
Yes.
Leg pain was pretty much gone?
I had about a 10-second span on the way home from the procedure of what the pain used to be like, but then it was gone. And then I had one more instance of it, and it's been gone.
And you could hardly walk. You could walk maybe 100 feet with difficulty and stand for 5 minutes, and you were pretty much dependent on a walker and a shopping cart. And now pretty immediately your strength came back, and now you're walking much more.
Much more than I was. It's definitely a huge improvement.
So you're pretty pain-free.
I'm pain-free.
And there was minimal surgical pain, which is not exactly, I mean, most people have a lot more pain than you do. Most people have about a week of pain, but you did really well.
Yeah.
Now you're a lot more functional, and we're going to be going where over the summer? You're going to?
I'm going back home to Ohio.
Ohio for the summer,
Yeah.
and this is like 2.5 weeks later. She's going to be able to travel now and do her physical therapy, and we'll get that leg stronger and stronger, and you should be a lot more functional and back to normal. So
Definitely.
fantastic. Okay, well, I'm really happy for you.
I owe you everything.
Well, it's been my pleasure.
Thank you so
Thank you
much.
so much.